It is a very important rheumatological entity, but let me tell you, very many of the patients actually present to a nephrologist at first and then maybe get referred on to a rheumatologist for opinion, because lupus nephritis is the most important clinical entity, and it is perhaps the most life threatening clinical symptomatology a SLE patient has. So let's begin with a very, very important topic, SLE and lupus nephritis. So, at the very outset, I would first like to discuss the new criteria that has been out very recently, the last year itself, in 2019, which is the ACR Euler classification criteria for SLE. We all know that prior to this, we had the ACR criteria in 1987, which was succeeded by the 2012 SLIC criteria, which has now given way to the ACR Euler classification criteria in the year 2019. And there have been very many important changes that will be asked very, very commonly in your super specialty entrance exam, be it in your nephrology portion or be it in your medicine portion, but it is very, very vital to know. First of all, there has been inclusion of an entry criteria which was previously not there. So it says that there is a mandatory entry criteria of an ANA positivity of more than equal to 1:80 positivity on Hep2 cells or an equivalent positive test ever. So this has to be there. If it is absent, the patient does not classify as SLE. So basically, you cannot label an ANA negative person to be SLE. Moving on. So apart from that, the criteria have been further divided into domains. There are 7 clinical domains and 3 immunological domains. What are they? Namely, the clinical domains are constitutional, hematological, neuropsychiatric, mucocutaneous, serosal, musculoskeletal, and very, very important, renal. And the immunological domains are the specific SLE antibodies, including the anti-dsDNA and the anti-Smith. Then you have the anti-phospholipid antibody. Then you have the complement proteins. So cumulatively, a person must have a score of 10 or more to be diagnosed as lupus, in addition to the mandatory entry criteria not to be forgotten. So a new inclusion that you must have noticed, which was not there in the previous SLIC criteria, is the inclusion of fever, which is the most common constitutional symptom, which is the most common presenting symptomatology an SLE patient presents to you with a weightage of 2 points. So we shall again recall the point. So I told you that the very first thing is that inclusion of a mandatory entry criteria. Number 2, the points have been divided into domains, and the sub points there are further sub points. Thirdly, inclusion of a constitutional criteria, that is fever, in the clinical criteria, which was not there previously. Then the sub points under each domain have been given weightage, have been given points. Like leukopenia has 3 points, thrombocytopenia has 4 points, and autoimmune hemolytic anemia has 4 points. And you will only take that point which has the highest weightage in that domain. For example, if a patient has both leukopenia and thrombocytopenia, you cannot count it as 3 plus 4 is equal to 7. You will only take 4 into account, because under each domain, you will only take the highest pointed category. Now, very, very important, for the very first time, the renal, which is of the most concern to us, the renal involvement has been classified subclassified into biopsy types. So if a patient only has more than 500 milligram proteinuria, he will have a point weightage of 4. If on biopsy he has class 3 or 4 lupus nephritis, he will be having a point of 8. And if he has class 2 or 5, that will be 8 points. And if he has class 3 or 4 lupus nephritis on biopsy, that is proliferative category, has been given the maximum weightage, that is 10 points. So to say, if a patient has class 4 lupus nephritis or class 3 on biopsy, does he need any other criteria? No, because that itself will fetch you 10 points. So that is itself to label a patient to be having as SLE. Of course, with the entry mandatory criteria, that is ANA positivity. Now, in the immunologic criteria, you have the anti-phospholipid antibodies, low complements, and of course, the anti-dsDNA or the anti-Smith antibody that is having a weightage of 6 points. So this is the new criteria, which is very, very important, can be asked you in any permutation combination. Very, very important to remember. Okay. Now, this is the previous criteria that we all have studied. That is the 2012 Systemic Lupus International Collaboration Criteria of SLE, and which had basically two gross domains. That was a clinical domain and the immunological domain. The clinical domain had 11 criteria, while the immunological domain had 6 criteria. So out of those 17, you needed to have more than equal to 4. And of course, at least one needs to be from this and at least one needs to be from this. And then you can label a patient to be having as SLE. Now, the thing to be noted here is, as I mentioned you previously, so what are the changes in the new ACR Euler criteria? So, we have more or less studied both the criteria separately in a small gist. So what is the take home message? That what are the gross changes? Number 1, there is inclusion of an entry criteria which was not there. That is an ANA positivity of more than equal to 1:80 titer on Hep2 cells. Very, very important. Number 2, there is an inclusion of fever as constitutional feature in the clinical domain. Number 3, each domain has been given points. So there is a weighted system which has been included, which was not there. Number 4, biopsy. The renal biopsy has been subclassified. How? The proliferative categories and the non-proliferative categories. The proliferative categories have been given 10 points and the non-proliferative categories have been given 8 points. Very, very important. And last but not the least, if you all have carefully noticed, in the 2012 criteria, among the immunological criteria, there was the mention of a Coombs test, which has been omitted in the new criteria. Can you see any Coombs test being mentioned here? No. So, the very important 5th change that has been implemented in the recent criteria is omission of Coombs test from the immunologic criteria. So mainly these are the 5 new changes that have been implemented into the new criteria and which will help you remember the differences between the previous one and the old one. And of course, why was this implemented? Basically to increase the specificity and sensitivity of the criteria to diagnose patients and classify patients as lupus. So after having diagnosed a patient to be having SLE,